Hi, my name is Tori. I'm here with Ethan, who's one of the developers of an up-and-coming prescription drug education advocacy group called Health is Lit. And today we're here to talk about how an organization like Ethan's can help Cal Poly students. So to start us off, what's the goal of your program?
Yeah, so thanks for interviewing me, Tori. It's really a pleasure to meet you. The goal of our overall program is to educate Cal Poly students about drugs and the substances they are taking. This is important because we feel that everyone should have the right to know about what they're putting into their body. So through our website, we just want to improve students' health literacy, but more specifically, prescription drug literacy. Now, drug literacy, if you don't know what it is, it's basically having the knowledge and tools available to navigate the world of drugs in order to make sure the decisions you are making are safe and healthy.
So that sounds like a pretty broad topic. What prescription drugs are commonly misused on Cal Poly campus, and why does that matter?
Yeah, for sure. So there are a few commonly misused prescription drugs on campus here at Cal Poly. I would say the most relevant one is Adderall because we do see that it is the most commonly used here specifically. However, in the entire United States, we do see a large variety of prescription drugs being misused, and that can include barbiturates like Xanax and Valium, opioids including fentanyl, oxycodone, antidepressants like Lexapro, Zoloft, and stimulants like Adderall or Ritalin. Now, for a lot of people, I would say this is a very confusing subject, mainly because you see and you hear all these names and you're kind of just like, what does any of this mean? But that's also the reasons why we are here. We want to bridge that gap in communication between healthcare and like drugs and to you, the person.
So now that we know all the drugs that are being used on campus, what are some enabling factors that college campuses that encourage unhealthy prescription drug use?
Yeah, for sure. So there's actually been a recent study from a psychiatric journal that found that on college campuses, very specifically, the students that felt high levels of academic pressure, people who regularly missed class, and those who had a lower GPA are actually more likely to misuse drugs. Now, researchers also found that organizations such as Greek Life were more likely to also misuse prescription drugs. So, I think that it's a very important topic that like definitely should be discovered and discussed most of all. And there are a few takeaways from this, and I'd say the most important one is that unprescribed medications for academic purposes actually don't result in a higher GPA, which is a reason why a lot of students use Adderall.
So it seems there's a lot of reasons people use prescription drugs, but a lot that are specific to only college students. Why do you think focusing on health literacy will be an effective approach for college students?
Yeah, so we know through past trial and error that college students are not great at following directions. And that still holds true to some extent. So it's difficult to expect this population to never use drugs, especially since prescription drugs are so common and available, right? So we have to accept that college students will probably try to use these drugs in recreational ways. And because of this, we want to have a harm reduction approach to preventing drug misuse, which a lot of it for us, our interpretation means improving drug literacy so college students can stay safe. Right. So actually, a study that reviewed the effectiveness of illicit drug intervention programs found that harm reduction outreach programs were more effective and had a strong economic support, unlike unsuccessful programs of prevention, like DARE, if you've ever heard of it.
So it sounds like drug education is needed, but shouldn't we focus on preventing alcohol abuse since it seems to be more of a prevalent issue on our campus?
Yeah, so I'm actually really glad you brought this topic up because one of the reasons why we wanted to focus specifically on like prescription drug use is because there's already a lot of resources that Cal Poly itself offers to issues such as alcohol abuse, to drug abuse, and to other types of drugs that aren't necessarily prescription, right? I can list a few off the top of my head, like counseling services, Mustangs for Recovery, the Nicotine Cessation Group, and peer health educators, right? And so, as an organization, we recognize that there aren't that many resources that specifically target the lack of drug education and the effects of prescription drug abuse, right? So, although that you could argue that prescription drug abuse isn't as large as an issue as alcohol abuse, marijuana abuse, it's still a very important topic that people need to like know and like educate themselves about, because there still are students on campus that struggle with prescription drug abuse.
Right. So your goal is to educate students on drugs, but would we be worried about students getting the idea to start taking drugs from a program like this?
Yeah, so I'm actually really glad you brought this up because there are many programs in the past that focused on abstinence and scare tactics to like reduce the whole substance use. And to be honest, all of these have not been very effective at doing what they're supposed to do. And like I mentioned earlier, DARE is a really good example of a program that focused on scare tactics and abstinence. And we knew like 10, 20, 30 years later down the line that this didn't work. Right. So we want to give students confidence to navigate their prescriptions, which I think is a really big emphasis on our part. And we believe that if students are educated and engaged in harm prevention, they'll be less likely to misuse substances, and they'll be more likely as well to kind of help their friends out and like educate their friends. So it's kind of like this constant like positive feedback loop of education.
Right. So I can see how your program is definitely needed on campus, but why should students go to your website over another organizations? What makes Health is Lit stand out from the others?
Yeah, so our program is very specifically tailored to educate college students and their needs. Through our research that we have done, we have specifically created the website with students in mind, making sure that information that we have is digestible and that the website is just easy to navigate, you know? So by building our website, our program actually allows users to stay anonymous, compared to such programs like, I don't know if you've ever known or if you ever used it, Mustangs for Recovery. It's not a very anonymous source or resource that someone can go to, right? And there's been many systematic reviews that show that like electronic health programs are actually pretty effective in health literacy interventions, especially in interactive websites like the ones that we are going to bring out. So obviously, our biggest goal is tailoring this program to educating college students. And our program itself will be developed through research and applies our health behavior theory. And ultimately, the goal is to make sure the information is digestible and that you, the user, can understand it at all costs.
Well, thank you so much for your time, Ethan. I can't wait to see what your organization can do for Cal Poly students.
Yeah, thank you so much for the interview. I hope to see you guys again.
Me too. Have a good one.
You too.